Hello everyone, welcome to my RADP 230 movie assignment. Today, I will be going into detail about hemorrhagic strokes. As you can see in the picture I have listed, ischemic and hemorrhagic strokes are different in the way of how they are caused. So the etiology of hemorrhagic strokes is that hemorrhagic strokes occur by a weakened blood vessel that bursts either within the brain itself or within or in between the dura mater and the arachnoid matter that surrounds the brain. And as a result of the vessel bursting, blood then bleeds within that area. Now, the incidence of this stroke make up around roughly 13% of all strokes that occur, and ischemic strokes make up the rest of that 83%. Now, there are two types of hemorrhagic strokes. One is an intercerebral stroke, which occurs within the brain itself. And then the subarachnoid stroke occurs between the dura mater and the arachnoid mater. Now, these are just some general symptoms that occur when someone is having a stroke. So the first one is FAST, which stands for face, arms, speech, and time. Now for face, it's when one side of their face starts to droop down. For arms, when they hold their arms up, one arm tends to drift down. When they talk, they're tending to slur their speech, so they sound intoxicated. And for time, every second counts, and it's important to call 911 immediately after the symptoms first start to appear. Now for VAN, it stands for vision, aphasia, and neglect. So if the person is having double vision, if they're seeing little black spots in their field of vision, or if they're having some vision problems. Now for aphasia, that they're confused about where they are or what an object is. If you hold up an object like a pencil or a pen and you ask them to name the object, they won't. They'll have some confusion about what the name is or what that use of that object is. Now for neglect, they'll be neglectful of one side of their body, so they won't be aware if they're getting that side of like their arm or hand stuck in a door, in between a chair and a wheel, stuff like that. Now I have listed off some left hemisphere versus right hemisphere deficits, depending on what hemisphere the stroke occurs in. To list off some right hemisphere deficits, it's spatial and perceptual deficits, attention and focusing issues, agnosia, which is trouble recognizing objects, faces, voices, or places, and so on. And then for left hemisphere, it is receptive, expressive or global aphasia, motor apraxia, and verbal apraxia. Now for life expectancy and mortality rate, sadly for hemorrhagic strokes, roughly around 60% of hemorrhagic stroke patients die within the first year of having their stroke, and the roughly 40% that do live longer than that 1 year have a much more elevated risk of death than the average population would have. So they're more at risk of dying than, say, you, me, or anyone that doesn't have any health issues. Now I will be attaching the Word document with my list of references so you guys can go through the list and maybe learn something else that I haven't listed, maybe even learning about ischemic strokes more in detail. I hope you enjoyed my presentation. Thank you for listening. Have a good day.